I'm Dr. Frita, and today I'm giving you 10 chronic kidney disease symptoms you should refuse to ignore. I'm a board-certified kidney doctor, and one of the most painful parts of my career is when I see patients with kidney failure that could have been prevented had only they recognized the early symptoms. And the mind-blowing thing is that the top 2 causes of kidney failure, the top 2 reasons that people end up in my dialysis units, are largely preventable, or at least manageable. The good news is that there are ways to detect kidney disease early and to prevent, or at least to slow down the progression of kidney disease. So today, we're going to be proactive problem solvers because I'm giving you 10 chronic kidney disease symptoms you should refuse to ignore. Keep watching. Ever felt overlooked or not heard in a doctor's office? Frustrated with waiting rooms and rushed consultations? I'm Dr. Frita, and I have the perfect remedy. I'm a medical doctor who has been triple board certified, and I believe everyone should have access to world-class healthcare. I want to personally invite you to experience my VIP consultation telehealth services. Click the link below and book your VIP consultation today. What is CKD, or chronic kidney disease? Well, CKD occurs when you have damage or a decrease in your kidney function for 3 months or more. At that 3-month mark, it's when we call it chronic kidney disease. Now, there are multiple causes of CKD. The top 2 are diabetes and high blood pressure. And we're able to determine if you have CKD really based on your blood work. When you get a BMP, or basic metabolic panel, it has your creatinine there, and it also has your eGFR, estimated glomerular filtration rate. And depending on what that GFR is, that's how we stage your kidneys and determine whether or not you have CKD. Be sure to watch my video on CKD stages after you finish watching this video. So your kidneys are your 2 organs located in your lower back or your flanks where the love handles are. And quite honestly, they are really underrated. They don't get enough press. Yes, I am biased because I'm a kidney doctor, but the kidneys are super important. Not only do they filter out your excess fluid from your body, they help to maintain your balance of your electrolytes, they help to maintain your blood pressure, they also help to keep you from being anemic, and they help to promote good bone health. And here's the real kicker. If both your kidneys fail, then you cannot live unless you have another form of kidney replacement therapy like dialysis or a transplant. But honestly, if you can, wouldn't you want to prevent getting to the point of needing dialysis or a transplant? The wonderful thing is that if you recognize the symptoms of kidney disease, in many cases you can. So that's what we'll be getting into in this video. So now, here are 10 CKD signs and symptoms. And it's really important that you recognize them because if you're not careful, it's easy to be in denial or to dismiss them and say, oh, I just slept wrong, or oh, I've just been working too hard lately. You can always come up with a reason, but you really want to pay attention because if you or a loved one is experiencing these signs or symptoms of kidney disease, then it's possible that if you catch them early and you seek medical attention, you could literally prevent going into kidney failure. Number 1, high blood pressure or hypertension. And this is really interesting because in this case, it's like what came first, the chicken or the egg? Because high blood pressure can definitely cause kidney disease, but having kidney disease in and of itself can cause high blood pressure. And remember, by definition, you have high blood pressure if that top number or systolic is greater than or equal to 130, or if that bottom number, the diastolic blood pressure, is greater than or equal to 80. And if you have this high blood pressure, you want to make sure that your doctor does further tests to find out if kidney disease is the cause of the high blood pressure. Number 2, swollen feet and ankles. Yes, you know, having swollen feet and ankles, a lot of people may get them at the end of the day, or they may say, oh, it's because I had a little bit, too much salt, or I was on my feet too much. Okay, you can come up with a million reasons, but guess what? You don't want to miss this reason because chronic kidney disease could be the reason for swollen feet and ankles. So yes, you can have swelling or edema of the feet, the ankles, the legs, even of the entire body, a generalized edema or an anasarca. You can also get puffiness of the eyes. And this occurs in chronic kidney disease when your salt balance is not proper. You could be holding on to salt, which makes you hold on to more fluid in your tissues, causing a puffiness or the swelling of the feet and ankles. The swelling can also happen in CKD if you've gotten to the point where you're not making enough urine, so you're holding on to excess fluid, and this is causing you to have the swollen feet and ankles. Or if you have a form of CKD that causes protein leakage, which can cause a swelling in your body. Number 3, foamy or dark urine. Oh yeah, so these are really, really important symptoms of CKD, because if your urine is foamy, that could mean that you have excess protein in your urine. So it's normal to have 0 or very minimal protein in the urine. If you have excess protein in the urine, it can cause a foaminess when the urine hits the toilet. And I don't mean just a couple of little bubbles here and there. I mean really foamy, like in those beer commercials when you see that white foam when the beer is being poured into the glass. Yeah, foamy like that. So if you see foam in your urine, this could definitely be a sign that you have CKD. Also, if you have a dark urine or something that looks like it could be blood in the urine, or if it's Coca-Cola colored, this could mean that your kidneys are leaking out red blood cells. It is not normal for the kidneys to leak out red blood cells. And if so, that is a sign of damage and definitely could be one of these signs of CKD. Number 4, fatigue. Now, of course, there are so many things that can cause fatigue and you just, being sleepy all the time. 1, it could be because your body is holding on to excess poisons or toxins, and those are causing you to have fatigue or be excessively tired. Also, in CKD, you could have anemia. Remember, I told you that the kidneys are responsible for helping to prevent anemia. So if you have anemia or low blood, this can cause fatigue, and this could be one of those warning symptoms of CKD. Do any of these signs and symptoms of CKD sound familiar? Do you think that you or a loved one may be experiencing CKD? Do you want to talk to me about it? Well, guess what? Now you can, because I have a telehealth concierge service. Yes, we can arrange a one-on-one appointment. We can talk about your history, your physical, your signs, your symptoms, your concerns. I will give you my undivided attention. So please click the link in my bio and schedule a concierge appointment with me today. Number 5, shortness of breath. You can get shortness of breath in CKD, 1, just because you're fatigued and just, trying to move or walk can make you tired. But also, if you have CKD and you're not making enough urine, you can have a backup of fluid in your body, and you can get fluid in the lungs or pulmonary edema. This can certainly make you short of breath. Another thing, the anemia. When you have anemia or low blood, then your tissues are not getting all of the oxygen they should get. You see, your red blood cells act like cars, which carry your oxygen to your tissues. If you have anemia associated with CKD and you're not getting enough oxygen, this can lead to fatigue, which can lead to shortness of breath. Number 6, loss of appetite or even weight loss. Now, this one is really something that I see quite often. It's one that's easily masked. I'll have patients who come in to see me and they will have CKD, but they'll tell me, oh yeah, I lost weight. I've been trying to lose weight for years. And I guess, now I have portion control. I'm just not eating as much. And they may tell themselves or really think that they're losing the weight on purpose. So if you have CKD, this can cause a buildup of excess toxins in your body, which can cause you to have a poor appetite or nausea or vomiting or unintentional weight loss. If this is happening to you, it could be a sign of CKD. Number 7, changes in urination. Now, you can have a change in urination by not putting out enough urine, okay? If you have chronic kidney disease, the kidneys aren't filtering well, you can make less urine than you should and get a buildup of fluid in your body. Or you can have a change in urination, meaning that you're making too much urine, or you have polyuria. And this is how that happens. Your kidneys are responsible for concentrating your urine, right? Making sure that all the toxins and things that need to be in there are in there so you can get rid of these excess waste and have a balance of your electrolytes. Well, if you have CKD, then sometimes you lose the ability to concentrate the urine. And then you get a very dilute or watery urine. So often, one of the symptoms of CKD could be making more urine than you're used to making, or having frequent urination, or getting up oftentimes at nighttime, or having nocturia. Yeah, so changes in urination definitely could be a symptom. Number 8, itchy skin or pruritus. So yes, many things can cause you to have itchy skin. It could be that you're having an allergic reaction to your detergent or to a soap or to a new lotion or perfume. Sure, these things can do it, but CKD can do it as well for many reasons. One, you have a buildup of toxins in your body, and this can cause your skin to have an itchiness, or you can get a very dry skin. And then there is something called phosphorus. Phosphorus is a substance that your kidneys are responsible for filtering out. And you find phosphorus in all kinds of things. You find it in prepackaged foods, processed foods. You can find it in nuts. You can find it in milk. Well, if you have CKD and you're not getting rid of phosphorus the way that you should, then you can get a buildup of phosphorus in your body or in your blood, hyperphosphatemia. When this happens, one of the very common reactions is pruritus or itchy skin. So if you're having itchy skin, this could be a symptom. Number 9, bad breath or a metallic taste in your mouth. Yes, this could be a symptom of CKD. So when you have chronic kidney disease and some of these toxins start to build up and you have a uremia, okay, or a high BUN, blood urea nitrogen, this could cause you to have a metallic taste in your mouth. And this is actually one of the later symptoms of CKD. And when you get this metallic taste in your mouth, it makes you just not want to eat. Food just doesn't taste the same. And also, you can get an unpleasant odor in your breath. Literally, your breath can smell like urine, okay? And so if you're having a really strong odor in your breath and all the brushing in the world doesn't help, or if you have a metallic taste in your mouth, then you may have CKD. Number 10, difficulty concentrating or other neurological signs and symptoms. So when you have CKD, particularly the late stages like CKD stage 5, the buildup of toxins or the buildup of the BUN, having the uremia, can agitate your nervous system, okay? It can affect your brain. It can affect your nerves. It can cause you to have a brain fog or difficulty focusing or concentrating. It can also affect the way that you walk, okay? You can get an ataxia or an abnormal gait, okay? The way that you walk can be off. You can also get a tremor, okay? So if you're having a fine tremor or finding that you're not able to hold a fork properly or hold a cup of coffee without spilling it, this could definitely be a sign that you have CKD. And certainly if you're having some memory loss, talk to your doctor and make sure that your kidneys are functioning well. How do you know when you need to talk to your doctor about kidney disease or when you need to see a nephrologist? Well, spoiler alert, you need to talk to your doctor right now, not because you have kidney disease, but because you definitely want to prevent it, right? So when you do your routine histories and physicals, which you should be doing at least every year, they do a panel of blood work, and in that panel, they do screen for kidney disease. But you need to be proactive and you need to be your own advocate. So when your doctor gives you your results and they say, oh, everything looks fine, the kidneys look fine, you need to back up and say, what does fine mean? What is my EGFR? If your EGFR is less than 60, then everything is not fine. I don't care if you have no symptoms, everything is not fine. If the EGFR is less than 60, then it is recommended that you be referred to a nephrologist or a kidney doctor. So when your doctor tells you your kidney function, you ask specifically what it is, okay? And if it's less than 60, yeah, you see your kidney doctor. The other thing is if you're experiencing any of these signs and symptoms that I mentioned, you pick up the phone, you call your doctor, and you ask for an appointment because you can go in, they can check your blood work, they can check your urine work, they can examine you, and they can find out if you're someone to watch. They can also find out about your family history, okay? Or screen you for diabetes, screen you for high blood pressure, screen you for the possible risk factors of kidney disease. There are some symptoms that are urgent or even emergent, okay? So if you're having some of these neurological symptoms, okay, if you're having an abnormal gait or the way that you walk, if you're having a tremor, then that's an emergency, okay? You want to contact your doctor immediately or even call 911 depending on how severe the symptoms are. Also, if you can't eat, if you're having nausea, vomiting, bad taste in your mouth to the point where you're not eating, not drinking, or you can't keep anything down and you're dehydrated, oh, that's urgent. You need to call your doctor right away. There's also certain blood work that could signal an emergent situation. For example, when you go in to check out your kidney function, if you find out that you have hyperkalemia or a very high level of potassium in your blood, this could be something that is an indication for emergency dialysis even. So yes, it's important that when you have certain signs and symptoms, you seek medical attention right away. So now let's talk about some important questions you should ask your doctor concerning your kidney disease to make sure that you're heard. Oftentimes, the squeaky wheel gets the oil. So the more interest you show in your own kidney health, the more attention you'll oftentimes get from your doctor. I'm not saying that's the way it should be, okay? Because everybody should get equal attention, but this is oftentimes the way that it is, okay? So the more you know, the more interest your doctor will sometimes show. So even if you think you know the answers to some of these questions, these are some of the things that can really perk your doctor's ears up, okay? Ask your doctor what signs and symptoms you should be looking out for CKD. Ask your doctor how often you should be checked. And just so you know, if you have an eGFR of less than 60, then it's recommended that you see your kidney doctor at least once every 3 months. If your eGFR is less than 30, you should be seeing your doctor by recommendation every month, okay? Ask the question though. Make sure the doctor knows that you're interested. Ask your doctor what tests can be done to pick up kidney damage early. And again, even if you think you know the answer, ask the question, okay? And then you can compare what the doctor says to your notes. And just so you know, the BMP should be checked to pick up kidney disease early, right? Your creatinine, your eGFR, also your urine protein should be checked. Your urine protein to creatinine ratio. A urinalysis will help. Ask your doctor what that doctor will do to monitor your CKD. Ask your doctor if there are any medications out there that can help to slow down the progression of CKD. The answer is yes. Ask the question. And very importantly, ask your doctor what you can do at home in your daily life to help to prevent or to slow down the progression of kidney disease. Okay, so here are some things you can do in your daily life to help to prevent CKD or to slow down the progression of CKD. Well, I already mentioned that the top 2 causes are diabetes and high blood pressure, right? And so you want to make sure you are properly screened for diabetes. How can you do this? Ask your doctor what your blood sugar levels are, specifically your fasting blood sugar levels, and also your hemoglobin A1C. You want to make sure that you have a diet that is high in protein, high in vegetables, and that is low in carbs. You don't want to have a lot of starchy foods. You don't want to have a lot of added sugar. Be sure to watch my video on what added sugar does to your body after you finish watching this video. The other thing you want to do is maintain a normal blood pressure. High blood pressure is the number 2 cause of kidney failure. So you want to eat foods that are low in salt. You want to make sure that you get your blood pressure checked regularly. And if you do have high blood pressure, you want to manage it, not only with lifestyle changes like diet, exercise, eating the proper foods, but also, if necessary, you may have to take medications. Other things you can do, drink water. One cause of kidney failure is dehydration. Can you believe it? Not drinking enough water can cause kidney failure. So make sure you consult with your doctor and you find out what the proper amount of hydration is for you. And be sure to watch my video on the importance of water drinking for kidney health after you finish watching this video. You definitely want to eat foods that help your kidneys to filter better. Yes, you want to eat foods like the cruciferous vegetables, kale, broccoli, Brussels sprouts. You want foods that are loaded with antioxidants like raspberries, blueberries, blackberries. Watch my video on the truth about kidney detox after you finish watching this video. Basically, prevention is key. So recognizing the signs and symptoms of CKD and doing something about it early on, well, that's the key to having good kidney health. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. As always, I appreciate your support and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.